Hi all, Christine Meyer here from my car, and I feel like sometimes this is the only place I get some peace. I've been an esthetician for 18 years and I specialize in microcurrent facial toning, facial contouring massage, avatar, fibroblasts, skin tightening, all sorts of anti-aging procedures. I turned 50 this year, so I've been on a sort of an anti-aging rampage, and I wanted to do a series on the neck because everybody hates their neck. And does anybody remember that book by Irma Brombeck, was that her name, called I Hate My Neck? It was a really funny book. I think it came out, I think I read it in my 20s, and I'm 50, so it's been a while. Really quickly, something you can do for your neck, especially necks past 30. We lead a sedentary lifestyle, so we have a desk job and we're sitting in a chair doing facials all day. No, just sitting in a chair, not moving around much. Something you can do to start to move lymph, because lymph is our body's garbage disposal system, and it does not have a heart like our circulatory system has. Our blood is pumping through our body, through our heart, which is a muscle, pumps it. There is no such pump for the lymphatic system. And so what happens to a lot of my clients and to me is that we accumulate lymph right here. And it's usually enough so that when it's moved, we can see a nice difference in our svelte jawline returns. And anyway, so let me show you how to do that without any tools whatsoever. I mean, I love the Anma, which is the gua sha tool that was tweaked by Jane Mans, where she took an old concept and made it fabulous. You could do that, and that's a great tool. I use that constantly in my clients. But when I want to start clearing out some lymph in my own neck, and I want to start getting to some deeper stuff that's caused by, it's sometimes called text neck from looking down like this. And so the platysma and the sternocleidomastoid, which is these big wiry things right here, you can feel them on people, they get tight and they get shortened. And so instead of when you look up, they snap up into a nice jawline, they kind of do something more like this. Now, there's other stuff going on there. We can get submental fat, which I loathe, but it happens to the best of us. And that's like where all this lovely fat that was up here sort of migrates down and up underneath our chin as we get older. And it happens to, I would say, almost all of us, unless you have a supermodel neck. So, and then they get wrinkly. So aging provides justice for all. What I would do first is I like to work on the sternocleidomastoids, and never underestimate the power of a good old neck stretch to start to get all this moving. And so do this gently. And once again, I'm not a doctor. If you have any neck problems, do not do this. If you have whiplash or that kind of stuff, do not, check with your doctor, but you can definitely loosen up your neck. And what I find works for me quite a bit too is to just side to side. So if you have been just sort of not been moving your neck around too much, that lymph is going to accumulate, and this happens. Okay, so I like to come in here, and if you have fingernails, which I do not, take them, you can curl your finger in so that you're not digging into your skin. And you can also just grab like a towel or a pillowcase and put your hand up in it and start to, pair of gloves and do this, just so you don't leave claw marks into your face. And so you're gonna feel this SCM, this big wiry sternocleidomastoid all the way down, right? And this is what I do this to my clients. And what I'm essentially trying to do is I'm not trying to like pull and tug on the skin, but what I am visualizing is getting up underneath that. And because a lot of lymph gets trapped underneath these really tight sternocleidomastoids, SCM muscles. And so what I like to do is, you know, I usually have copious amounts of like massage medium on, some sort of oil. But even if you don't have any of that and you want your neck to look better, you're going to a party or whatever, you can start to clear out the lymph in your car on the way to the party. A little bit late, but I'll do this a lot of times. Also love cupping. I think I showed that in a video a couple years ago, but I'll keep a little silicone facial cup in my purse. You see how that's starting to clear out already. I'm lymphy. I hold a lot of lymph. You can also do this. A lot of people, like if you have chin acne, that kind of thing, this is usually so tight, and I'm sort of digging up underneath the jaw. Hold a lot of stuff back here too. And if it hurts, you know, don't super dig. Don't like break anything. You're just trying to loosen up lymph. And once we loosen it up, it will know where to go, especially if we do some, you know, do the side to side. Give it a little help. Since it has no heart to beat it through, give it a little help and get it moving. All right, so that's already starting to look a little less lymphy. And as you walk around, it will drain some more. So I like to do this. What else do I do? Well, and then from here I start my microcurrent. That will be a continuation. One of these days I might get a neck lift. Anyway, this is as good as it's gonna get. And yeah, you'll notice that it starts draining pretty much right away. I've gotten the sort of thickest, lymphiest necks to move just doing this. And you can sort of, I like to dig into here. I wouldn't call it dig, it's more of a scoop, because lymph is pretty superficial and it drains into this chest area. And so I like to open that up on people, and I'll sort of drain to the armpits like this. Don't know if you can see this, but you're draining, opening this up, and then letting everything sort of move down. So that's just a quickie. This is how I would do somebody's neck if they walked into me. And this can be very, very tight on people just from looking down so much at our phones, at our computers, at our desk. And so take it easy, just work slowly. Visualize trying to sort of get up underneath there. Don't dig into it with your nails. Drink a lot of water when you're done, but it will definitely start to loosen that up. And once you walk around, drink some water, it will drain. And you know, I'm pretty good at this now. And so clients will get up off the table and maybe they haven't had a drainage in a long time, and they'll look at me and say, wow. So keep draining, and may your neck be merry and tight. Bye, y'all.